And that's, you can keep that
go like
one
this.
extension, yeah. You
So
can do that.
if he's gonna get up and walk with this, and we're gonna let him get up and walk, we can use this to cover this plug while he walks, okay? But otherwise, you just hook this like that.
And usually it's connected. I would like to order low intermittent suction.
Okay.
Yes.
It's gotta remember.
Is that right?
It is now, but.
But it doesn't go out for some reason.
So you have to look at your dial, and on your dials, it will say low intermittent, or LIS. That stands for low intermittent suction. Intermittently, it will suction out the contents of the stomach. So you'll hear it, and you'll see it pull it out in little waves, okay? Then it rests, and then it pulls it out again. Okay, that's what they mean by low intermittent. Some may order continuous suction. It's always going to be. But what I see mostly is low intermittent suction.
So how's that pulling the air out of the bowels?
It's just
Sucking
suctioning.
it out.
Up through the stomach.
Like a vacuum, yep.
Wow, okay.
And sometimes you'll think it's not working, and it might be plugged, and then you have to irrigate it.
Huh.
And so to irrigate it, you have to turn it off, and then you would use this sort of
Normal saline or normal water, depending on your lab
To irrigate
results. If they were low sodium, if they were hyponatremic, and because they had an NG, and you'd want to use saline, okay? Because we want to put that salt back in. Not enough salt in their system can affect them mentally. Yeah.
So now let's pretend this NG has been in, and you're making rounds with a physician, and you're gonna try to determine whether this NG can be removed. In other words, what would be one of the indicators if that NG could be removed? What would be part of your assessment?
Bowels would not be so swollen, distended.
Okay, there's abdomen, not as distended. Right? That's right. And how would you assess for bowel sounds then?
Auscultate.
Okay,
What are you gonna do with this suction machine when you're doing it?
right.
Turn it off, yeah.
That
because
was
it's
what I
just
was
gonna
looking for.
So
Because
turn
it
it off.
interferes with listening.
This is the craziest thing.
And then Lori took her gloves off.
And I did
washed her
hand hygiene,
hands.
put the patient down, make sure that they're comfortable. Then to secure this, cause we don't want, they're moving around and things, so we put a piece of tape on it. Then I take a safety pin and I pin it to their gown. Give them some slack and pin it to their gown, okay? So that when they're moving, cause if they move too much, they could pull that out, okay? What about the patient who has an NG down, and now he or she starts vomiting? What's the problem? Think about it. Okay, they've got the tube in, but now the client is vomiting. He calls you into the room and says, I need an emesis bag, I'm gonna throw up, and he does. But you're thinking, gosh, he's got an NG tube down.
Aspirate?
He could, but what do you think's the problem with this tube?
Too far, not far enough.
What's that?
Too far, not far enough.
Which one?
Not far enough.
Not far enough.
Not far enough. It's come up, somehow it has dislodged out of the stomach, so it's worked its way up out of the stomach, okay? Or, what else could be the problem? Not everything is liquid, we have chunks sometimes.
Is it
It's
clogged?
blocked,
Oh.
plugged.
The other
Everything
thing-
isn't real, yeah, I know.
The other thing I've seen are the coffee grounds. and they're
Yeah, so if they have
soft,
an
very
ulcer,
chewy.
that,
It's
coffee
like
ground
copper.
emesis, that's what we could use it for too, NG. ulcers, stomach ulcers. And then you might put it down and do what we call a gastric lavage, or putting ice down it, ice water in it. Cause how does ice water help with vessel? Clamps them down, right? So yeah, so, but yeah, you wanna make sure that doctor's written the order for it, specified the size of the tubing, done all, checked with the client, has he had one before, he or she had one before. Once you get it down, make him comfortable. And now, are we gonna feed him? Can they eat, take medicines? No. Cause we put anything down their stomach, what's gonna happen to it?
It's gonna suck it right back up.
Yeah. So if you have medicines that have to be given, like heart medications, cause they will have an IV in, they have to be hydrated somehow. So the medicines that are important to them, that they get, like heart medications, blood pressure medicines, those things are gonna have to be given a different route, so that'll be part of your responsibility. Okay, to make sure the doctor orders them a different route, okay?
And say it is through the NG, say that is, do you think when you give that medication, do you think you're gonna hook them right back up to suction?
No.
No. You want that med to be absorbed into the stomach.
And it's one medication crushed at a time, dissolved in water, given through the NG, flushed with water, okay, one at a time. Cause what happens if they might have 10 medicines and you crush them all up.
So you give it just like you would flush it.
What's that?
You give it like you would flush it with the.
Yes, what I use is you crush the tube, you crush
Yeah.
the pill, make sure you can crush it, it's crushable. Some of our enteric coated medications can't be crushed,
Mhm.
our potassium can't be crushed.
So you
And your
dissolve 'em.
sustained
Your sustained
release.
release medicines shouldn't be crushed. So you have to make sure that they are crushable. Cause if you're in a long-term care facility, we had this happen years ago, they told us we could crush everything. Then all of a sudden, the pharmacist said, well, you can't crush that, and we're like, but that's what was written there. You could get docked, your institution could get written up because you're giving medications the wrong way. So make sure they are crushable. Just
And I'll
because
tell
someone
you
else is doing it is not always correct.
They'll tell you in your little handbook, your nursing handbook, if it can be crushed or not.
But I would crush it, put it in a med cup, put a little water with the pill in the med cup, and then I draw it out of the med cup with the water, and then I'd have gloves on for sure. And then I turn off my suction. I would clamp this, or I don't know if it's pretty. And then I give it through here, okay? And then I hook it back up and turn it off for a certain amount of time, okay?
Do you flush with water though then after that?
Then I flush
right?
with water after I give the medicine too.
Otherwise, it's sticking in the tube.
Yep. Okay,
I wonder if they can smell it.
And then we will document.
then we'll document. Do you
Right.
wanna document on the board what we're gonna do?
Sure.
What would you document? Why don't you guys take a minute and think about what you're gonna document, right on the back of your sheet there, what you would document concerning